I'm Troy Kirby with the Journal of Olympia, Lacey, and Tumwater with a quick look at the 2021 Washington. The Senate Committee on Health and Long-Term Care heard testimony on Engrossed Substitute House Bill 1141, which would increase access to the Death with Dignity Act. The bill passed the House on February 25th by a vote of 60-37 and would have to pass the Senate in order to make its way to the governor's office to be signed into law.
So this is coming from a constituent experience. The law was passed by the voters by an initiative, and I think there was intent to create many safeguards for the law, but after a decade of experience, we know that many of those have ended up being barriers.
Representative Rude mentioned a man with Parkinson's. My father has Parkinson's, and as his daughter, I would not want him to have access to medication like that. I don't think he would ever want access to medication that would end his life. But as his disease progresses, he has an incredible quality of life. There has been new trials he's been put on. He's doing remarkably well for how long he's had the disease. He's had it for like 15 years. And I just really disagree with this bill. And I also have concerns about what the standards would be, like the set standards for the children. Like if I ever have children, like what are they going to think? Like if we're ill and terminally ill, it's just okay to automatically euthanize us. And
just sharing a quick personal story here. At 11 a.m. on Friday, November 10th, 2017, I was finally able to pick up the prescription for my 85-year-old father's prescription. This is it right here. That afternoon, my family gathered at our home, said our final goodbyes, and as he took the prescription as prescribed, fell asleep within 2 minutes and died peacefully 20 minutes later. This came about as a long result of a battle with very significant chest pain and lung cancer and an unsuccessful surgery to remove it when they found the cancer had matriculated around the spine. The 15-day waiting period that he had to go through was anything but peaceful or dignified. He stayed home as he wished, and I watched him fight agonizing pain on the strongest level of opioids the doctors were able to prescribe.
I've been a counselor for more than 20 years, and the last 15 serving people who have the devastating diagnosis of multiple sclerosis. MS is disabling, incurable, and progressive, and has a further distinction because suicide is rated as a leading cause of death. Many people I've counseled have wanted to die by suicide, but to this day, I've never had a patient choose this death. I do not state this with pride, but I would be remiss not to mention the protective and therapeutic supports of counseling interventions.
This bill, I support 1141. It has nothing to do with the Medicare hospice regulations, contrary to your prior speaker. I have patients for whom I'm the primary care provider who are at the end of life, who are not able to appropriately access this law because they have chosen me to be their primary care provider. I am one of the most experienced palliative care providers in the state of Washington, and am more than capable of taking care of someone who is at the end of life. And I would argue that letting you know that most folks have to see me anyway, but they don't have the ability to participate in the law because they've chosen me. So passage of this bill will allow for greater access for those who choose nurse practitioners as their primary care providers.
E-prescribing and mail delivery are routinely used across the authorized states. Oregon, as a matter of fact, the pioneer in this movement, similarly clarified their law at the start of the pandemic.
My name is Dan Diaz, and I am Brittany Menard's husband. Brittany died on November 1st, 2014. She was only 29 years old. Brittany experienced a gentle dying process only because of the option of medical aid in dying. Yes, my wife utilized the very program that we are discussing here today. I'm testifying in support of HB 1141. Brittany's case received significant media attention because we had to move from our home in California to Portland, Oregon, so that she could access Oregon's law. Had we stayed in California, the brain tumor would have continued to torture her to death.
DRW has not been part of the discussions that led to these proposed changes, which is particularly troubling because members of the disability community are the ones eligible for assisted suicide and are directly impacted by these changes. Able-bodied people and healthcare providers often assume that people with disabilities have a poor quality of life or that they are a burden to those closest to them. We categorically disagree with these beliefs and worry that these are the reasons people will be pressured or even coerced into assisted suicide.
We oppose this bill because we feel that it would target people with disabilities and make it so that we would be encouraged to take our own life.
We believe that every stage of a person's life has inherent value. The ending stage is even more important than the beginning stage because a person has to draw on all of their character, their closest relationships, their resources in order to cross their finish line successfully.
I'm a 34-year-old civil rights attorney, and I have my own nonprofit disability rights law firm.
There you go.
I may require the use of a non-invasive ventilator 24/7 and numerous other medical interventions, and yet my quality of life is incredibly high. I live a purposeful and fulfilled life and have great hope for the future. Yet an uninformed medical professional without specialization in my disability, let alone someone who's not a physician, merely looking at my diagnosis would assume that I should already be dead and that I likely have less than 6 months to live. If I did not have a family and care team like mine that is completely committed to protecting me from an often dangerously ignorant and uninformed medical profession, I would be at great risk of death by ableism.
Thank you for watching the Daily Legislative Report by the Journal of Olympia, Lacey, and Tumwater, covering the 2021 legislative session.